It's 8:36, and in today's Health Matters, New York remains under an air quality alert this morning as hundreds of wildfires continue to burn in Canada.
And fears over the deadly Legionnaires outbreak in Harlem. The city health department investigating that cluster that we've been reporting on, right? Acting Health Commissioner Dr. Morse joining us this morning with the very latest information on this and more. So great to see you, Doctor, and thanks for being here.
Thank you for having me.
The last count in central Harlem was 58 people who have been diagnosed with Legionnaires' disease. Does it still stay at that number, or have you seen more cases?
I want to start by saying that this is our top priority right now in the New York City Health Department, and as the city's doctor, this is something that we're paying extremely close attention to and acting upon very, very quickly. As of today, we are actually up to 67 cases and unfortunately 3 deaths. Because of the time between exposure to the bacteria Legionella that causes Legionnaire's disease pneumonia, there is a lag in exposure to developing symptoms. So it's not surprising necessarily that we are seeing an increase in cases. We expect to see more cases as people who may have been exposed a couple of weeks ago may develop symptoms.
That's an increase, though, from the number of 2 deaths to 3 now. What are the ages of those folks?
So the people who are most at risk of the worst outcomes from Legionnaire's disease are people who are over the age of 50, people who have compromised immune systems or immune systems that aren't working perfectly, and people who are smokers or who have chronic lung disease. Those are people in particular who are vulnerable to bad outcomes from this illness. But if you're diagnosed and treated early, Legionnaire's disease is very treatable with antibiotics and outcomes are great. So our call right now, and my call to your viewers, is that if you live in the 5 zip codes in central Harlem that we're investigating for this cluster of cases, and you experience flu-like symptoms, so anything like fever, cough, shortness of breath, muscle aches, any of those symptoms, immediately seek healthcare access and provider access to make sure that you do not have Legionnaire's disease. And if you do, get treated as quickly as possible.
How is it transmitted, and is there any way to prevent getting it?
That is a very important question. So the good news is that Legionnaire's disease is not transmitted from person to person.
Okay.
So if you got sick with it, you don't have to worry that you might spread it to people you live with or other loved ones or people you're around. The way it is spread is the bacteria Legionella gets into droplets. Those droplets of water are spread from cooling towers that are at the tops of buildings. And so I want to be really clear with your viewers, this cluster of cases is not from water inside buildings. It's actually from cooling towers that are on top of buildings. That's why we have such a large zone of these 5 zip codes that we're investigating. So it's really important that people know that it doesn't matter the building per se, it's really that this is a large cooling tower at the top of a building and spreading to outside, not inside.
Wow.
So it's outside.
Okay, that was the question, because I think from what I heard from a couple people were saying, why is it specifically the cooling tower? Does it just affect that building? How does it get from one cooling tower to, say, another cooling tower in that zip code if it's not transmitted through person to person? It
is a really important question, and that's why I'm so happy to be here with you all. It really is because a lot of people are outside now because it's summertime, and because the buildings are often tall and have cooling towers at the top. With weather conditions and everything else, it's hard to predict exactly how the wind and everything is going to spread these droplets from the top of the buildings in the cooling towers. So you have no worries for people in these 5 zip codes to drink the water in their homes, to use that water for cooking. This is something that's being spread outdoors from these cooling towers atop the buildings. But again, the most important message is if you're in these 5 zip codes, I want you to seek medical care immediately, because if you are diagnosed early, the treatment for Legionnaire's disease is incredibly effective.
Okay. There are a few other things we want to talk to you about before we let you go. Our Kirsten, were you going to?
I just wanted to know, how do you stop the containment? I mean, if there's an issue up there, how do you stop it?
Okay, so it's our responsibility to, as soon as we identify a cluster of cases of Legionnaires like we did a couple of weeks ago, immediately look at all the cooling towers in that area geographically, and then we send our inspectors out to immediately investigate. The investigators take tests, a rapid test to see if Legionella is present. If it is, there is an antibacterial treatment that happens immediately. That has already happened for all 11 cooling towers where we detected Legionnaires, and our expectation is that that's going to cut off the spread of Legionnaire's disease.
Okay, real quickly before we let you go, our Kirsten Nicole has been working on that story about the carriage horse that died on the
Sure.
street. Do you know how soon that we could find out the results from a necropsy?
Well, first and foremost, it is really a tragedy. We're unhappy to see any loss of animal life like this. At this time, we are really still investigating and learning more about what happened and finding out the details. I don't have a timeline yet, but just know that this is something that we certainly take very seriously.
And real quick, again, because we talked about it and we teased it, the air quality alert that's been in effect for so many across the area.
Yeah.
What's your recommendation for certain folks?
I think for people who have lung disease, who are smokers, who have asthma, et cetera, those are the groups that are a bit more sensitive to poor air quality. So we encourage people to really be indoors if they have some of the conditions that make you more susceptible to irritation or symptoms from poor air quality.
Okay. Thanks so much for
Thanks
coming
for
in. Appreciate you taking the time.
My pleasure.